This presentation provides a brief introduction into orthodontics and dentofacial orthopedics. This presentation is brought to you by Columbia's chapter of Student National Dental Association. Orthodontics and dentofacial orthopedics is the area of dentistry all about getting your bite just right. What does that involve? Getting the perfect bite requires looking at and correcting two major parts of the face. That is, your teeth and your jaw. And how does it work? Most people associate the orthodontist with just braces, but there's actually a lot of really cool tools that are used to get the bite perfect. Below, we do see how metal braces are traditionally used to get the teeth into their proper position and give our patient a perfect, beautiful smile. In orthodontics, there's actually a couple of different phases, and in phase 1, or interceptive treatment, this is where the orthodontist may use a couple of his different tools. With phase 1, it's typically for patients that have a combination of baby teeth or primary dentition and adult teeth or permanent dentition. And it's everything done before braces to encourage normal growth and tooth eruption, so encouraging the teeth to come into their proper position, prevent space loss, eliminate bad habits, and many other things. An example of an appliance that may be used during phase 1 therapy is the palate expander. The orthodontist uses the palate expander to widen the top arch or maxilla in patients that may have things such as a V-shaped arch or a crossbite in which some of the teeth on the top appear in front of the bottom teeth and some of the teeth on the top appear behind the teeth on the bottom. Now, the purpose of the palate expander is to maximize orthopedic movement and minimize orthodontic movement. Now, what does that mean? By maximizing orthopedic movement, we're really looking to move the underlying skeletal structure, so widening the maxilla itself as opposed to focusing on moving the teeth. By widening the maxilla, this will help the permanent dentition or the adult teeth as they erupt to come into the proper position, not overlapping any of the other teeth, and really help us get that perfect bite we're looking for. Some oral habits, such as thumb sucking or tongue thrusting, can actually result in patients developing a V-shaped arch form. An example of an appliance the orthodontist may use to curb this habit is the Bluegrass Appliance. The Bluegrass Appliance is applied to the top arch, and there's a Teflon roller that sits immediately behind the front teeth where patients typically like to place their thumb or their tongue. By placing this here, the patient will not be able to continue the habit, and eventually the arch form will begin to return back to its normal positioning. Patients typically have the appliance in up to 6 months after stopping the habit in order to make sure that the habit doesn't reoccur. The second phase of orthodontics is aligner therapy. The most common type of aligner therapy used is metal braces. However, there's also clear aligners or Invisalign, ceramic braces, and lingual braces where the brackets are placed on the back surfaces of the teeth instead of the front. Patients will typically wear braces for 1 to 3 years until their teeth are brought into proper alignment and occlusion. In other words, until their bite is just right. The final and most important phase of orthodontics is the retention phase. After the orthodontist has been able to achieve proper alignment and occlusion of the teeth, it's time for the braces to come off and the patient is given a retainer. The retainer is worn as suggested by the orthodontist in order to maintain the final position of the teeth. And it is very important that patients wear their retainer because if not, the teeth can move back to their original positions. Examples of retainers used are clear retainers, Howley retainers, which have a metal wire, and permanent bonded retainers, where a wire is permanently fixed to the backs of the teeth. Here's a little quiz to test your knowledge on some of the things that we learned today. I hope you guys enjoyed the presentation. Thanks.